I'm Tom Anderson, and this is Webinar on Wednesday with Destinations Together. As always, a warm welcome to our Zoom listeners, the FCCA, and cruise line executives. Remember, this is National Travel and Tourism Week. As we mark this milestone, it is a bit eerie. Air travel is operating at 5% capacity, domestic hotels are at 25% occupancy, and the cruise industry is at a virtual standstill. Before we start with our featured speaker from the University of Florida, I want to provide a quick update on cruise industry news and our COVID economy, both facing significant headwinds. The no sail order from the CDC is scheduled to end on July 24th. On the heels of this date, Carnival has now announced they will start cruising on August 1st with a total of 8 ships from Florida and Texas. We are all hopeful that these dates will stand and not be delayed again. Despite this encouraging announcement by Carnival, the U.S. House Committee on Transportation and Infrastructure announced last Friday an investigation into Carnival Corp's handling of the COVID-19 pandemic. NCL, unfortunately, announced the furlough of approximately 20% of shoreside staff and is also experiencing significant financial challenges impacting their liquidity, and we saw their stock drop about 22% just yesterday. A festering issue for the cruise lines is the thousands of crew on ships unable to get home. This is generating regular negative press as the cruise lines and CDC try to agree on the repatriation plan. Royal Caribbean today extending their cancellation policy through April 2022. So with these headlines as the backdrop, there's no doubt that the world economy, as well as the cruise industry, is in turmoil. In fact, much of the world has been in a state of crisis since March 11th, when the World Health Organization officially declared the pandemic. Now, 56 days later, great efforts are being made to get back to work. Yet there has been incalculable economic damage. We are still in the midst of a crisis. As business and community leaders, how do we progress forward in this profoundly uncertain time? To help answer this and other complicated pandemic questions, Dr. Pennington-Gray from the University of Florida is here with us today to focus on crisis management. Today's presentation is hosted by Destinations Together, which is an open platform of relevant information and collaboration to support the cruise industry and to support you, the tour and port operators. It is designed to help everyone connect, collaborate, and hopefully find solutions to bridge the gap until cruise ships and tourism return to the region. Please visit our website at www.destinationstogether.com and follow us on Facebook and LinkedIn. Also, don't miss next week's webinar on Wednesday to learn firsthand how tour operators on the eastern seaboard of North America are reimagining their business to prepare for their first tourists of the summer season. I'll turn this over now to Larry with some important information and then introduce our speaker for today's Destinations Together webinar on Wednesday.
Thanks, Tom. Many thanks to all of you for joining us today. And we again want to extend our thanks to Mike Ronan and Steve Nielsen for last week's enlightening webinar. And if you missed it, the link for the recording is on our website. Before we get started, let me remind you of a few important housekeeping items. We are recording this webinar and we'll upload it on our website in the next few days. There is a Q&A tab below on your screen. Feel free to send through questions or comments. If time permits, we will try to address them at the end of Lori's presentation. You can also vote on any question you see in the Q&A to help ensure we include the most relevant ones. Again, we are not sure which ones we will get to talk about during this session, but your questions and feedback will provide us with intel on future discussion points. After Lori presents, we will pause for a quick poll to gauge everybody's impression on the session today. Please remember, we are only providing our opinion and provide sources for further intel. With all that behind us, let me introduce our featured speaker. Dr. Lori Pennington-Gray is a professor in the Department of Tourism, Hospitality, and Event Management, and is also director of the Tourism Crisis Management Initiative in the University of Florida in Gainesville. Her research uses a system approach to understand both demand side and supply side issues related to tourism. On the demand side, her primary research concentrates on risk and risk-related behaviors. On the supply side, her research is focused on tourism crisis management, Resilient Destinations and Disaster Management for Destinations Marketing Organizations. Dr. Pennington-Gray received her Ph.D. from Michigan State University and has been involved with global tourism studies as well as tourism policy initiatives in various countries. She has over 230 publications, and during this pandemic, she is speaking and advising journalists daily. She's very busy. Lori, and we're happy to have you. Lori, we're happy to have you join us today, and we are really looking forward to you sharing your research and with us all over the next 45 minutes. The show is yours. Thanks, Lori.
Thanks, Larry. Thanks, Tom. I'm going to pull up my presentation. All right. Well, thank you very much for having me today. It is a pleasure to be here and share information regarding tourism and crisis management with you. We have been engaged in research since January the 26th regarding COVID-19. This is even before there was an identified case here in the United States. The research institute that I direct at the University of Florida is primarily engaged in tourism research that will aid the industry in decision-making, marketing efforts, and communication. We felt that it was important that even before they had cases here in the US, that we were collecting information to be able to understand how this may impact tourism destinations here in the US and abroad. I'm going to turn my screen off so that when I'm speaking, it doesn't glitch. So I think it's important that we start with an understanding of the relationship between tourism and crisis. And so many of you that work in the industry recognize that tourism is an instrumental contributor to economies globally. And it can't be understated, especially with COVID-19, how this has impacted the industry and global destinations, as well as people's livelihoods. This is happening at the national, state, as well as local areas. This is why it's more important than ever to understand how we can protect our tourism assets and understand how we can put together better plans to be able to respond and be more sustainable in our approaches. When events occur which are unexpected and undesired, the need for immediate decisions and countermeasures are exacerbated. The more unexpected and novel the crisis, the less prepared we are. Therefore, the impact is greater and the response is slower. We see that now, as we move through the COVID-19 crisis, that these unexpected and extraordinary events have catastrophic impacts on our industry. And we can't take for granted that having a plan is one way to help to mitigate some of these losses. A proactive process enables us to minimize these losses and take advantage of opportunities. But this is far easier said than done. And I'd bet my left arm that most tourism businesses did not plan for a crisis as large and unfamiliar as this pandemic. When we started TCMI in 2007, one of the first studies we did was to understand the tourism businesses and their commitment to planning and having a crisis management plan. And we found that the majority of tourism businesses reported that they had a plan, but then when we looked deeper into what was in that plan, the majority of those plans represented a plan that was produced at a county level, or it was replicated from another private sector business. We were concerned that there wasn't the amount of attention to unique aspects of the tourism industry, and that people were really trying to piggyback off of areas where they had spent time, such as in the United States with emergency management. But we realized that this was not enough to be able to move us through the crisis. So back then, we even had enough interest to put together an outline for a crisis management plan that the industry could use as a template. We also knew that most businesses were either categorized as proactive or reactive. A proactive business was one that was able to handle many types of crises. And they usually use past experience as a way to understand how to deal with these crises. They put time into creating a tourism crisis management plan. And not only was it a plan that was available in print, but it wasn't simply a plan that ended up on a shelf that they thought they could pull down when a crisis arose, but it was something that was a living document. And we looked really hard to understand what the impact of investing in this type of tactic would be. And FEMA in 2018 put a dollar figure together, and they said that $1 of time invested in planning is equal to $9 saved in response efforts. And so that was a good indication that if we took the time up front to put together these plans, albeit we wouldn't necessarily be able to follow it completely, that it was better than not having anything or anywhere to start. So tourism crisis management has a variety of different models that can be used, but we felt that it was important to subscribe to the 4R model. The reason that we think that this is important is because this top R, labeled reduction, is an area that has traditionally not been focused on. And the best way to think of what this represents is to understand from a business model a SWOT analysis. So your reduction process is really looking at strengths, weaknesses, opportunities, and threats for your business in regards to a variety of incidents that can disrupt your business. And so each one of these follow in a phased approach, moving from reduction to readiness to response to recovery. Over the last 5 to 7 years, what we've done is created a series of criterion indicators that appear over the 4 phases of crisis management. We felt that it was important to put together strategic and tactical criteria for destinations as well as businesses in the tourism industry to be able to look at this plan and engage in the appropriate tactics for their specific business. Not all of the 126 indicators will apply, and not all will apply in every crisis. But it was a template for businesses and destinations to come together and identify what needed to be done at what phase of the crisis. And so really quickly, and this is pretty comprehensive, and we do offer an online course to build out a crisis management plan that gets into this more comprehensively. But in the reduction phase, there are main criteria which identify things like conducting a risk audit, building awareness in the community and with stakeholders about the crisis management plan and process, building communication systems, training staff and stakeholders, developing and initiating organizational structures for response, and then even government advocacy. In the readiness phase, the criteria include things such as outlining administrative procedures, developing operational actions, identifying and managing evacuation locations and facilities, designing communication plans, developing mutual aid agreements, identifying and addressing infrastructural needs, funding, and then training and awareness. And the response phase is the phase that we are currently in right now with COVID-19. And the things that businesses and destinations should be looking at include identifying the crisis and establishing parameters within a geographic area, implementing communication plans for brand awareness, implementing operational actions for staff, also financial actions, and then marketing plans. Planning both long-term and short-term strategic actions for opening and after opening or getting back to business. Engaging in ongoing information gathering and research. Managing your staff and employees. Playing a role in community advocacy in why tourism is important and how every business has a role. Engaging in government relations. Planning visitor management programs. And in the context of COVID-19, this would include such things as having plans put together for numbers of people that would be controlled within your specific attraction or your business, whether there are maximum numbers per hour, per transportation mode, etc. Designing and developing policies and strategies that you would push out to your consumers regarding sanitation, and then testing and exploring alternative revenue streams. And the final R of the 4 R's is recovery, and we are not there yet, but we should be planning for that time. We need to include such things as an employee recovery plan, consumer marketing plans, policy reforms, continued research that will lead decision-making and marketing strategies, documenting the lessons that have been learned along the way, continuing recovery communications, and then making a decision when you end the recovery communication piece and move into a more traditional communication message, continuing and extending community relationship programs, and then implementing visitor management programs. So again, the relationship to this overall plan for the Tourism Crisis Management Institute was to understand this piece on research, and we thought it was important in the decision making for businesses to understand some of the thoughts that were behind consumer sentiments regarding COVID-19 and travel. So again, I mentioned we launched our first survey January the 26th, and we have been continuing to collect data on a weekly basis. When we initiated it, it wasn't weekly, but now we're collecting weekly. We use an online panel with MTurk, and participants are paid to participate in responses. They must meet qualifying questions regarding whether they reside in the United States. So this panel is really only about US residents. whether they had traveled recently or were considering traveling within the next 6 months. So we wanted to see what responses from an active US traveler market. It was voluntary to participate, and it took about 15 to 20 minutes to complete. Data has been weighted to reflect the actual population in the US, and it's weighted by region of the country, age, and gender. And today, most of the data that I'll be presenting comes from both Wave 9, which was collected April the 27th, as well as this last Monday, which was collected May the 3rd. And then some of the data will be presented in a longitudinal fashion as well. We will collect again this coming weekend, and we will have new data available at the end of Monday. So let's get into what we know. One of the things that we've been committed to is risk perceptions, as Larry mentioned in the introduction, and my team of PhD students and other partners globally have really tried to understand risk perceptions from a variety of different constructs. We subscribe to a health model, and one of the things that we were primarily interested in was affective risk perceptions. So we wanted to know, what people were thinking and feeling. And this led to 3 variables that we have spent some time on and created an index around: anxiety, worry, and fear. The first question asked people to respond to their level of travel right now, both domestically as well as internationally, and how much anxiety they experienced about traveling right now versus how much relaxation they felt. The lower the number, the more anxious people are. The higher the number, the more relaxed they are. You can see from the data here that the numbers in blue, the domestic responses, were a little bit higher than international averages. This means that people in general, the US travel market, are more concerned and anxious about traveling internationally than they are domestically. However, if you look at the mean scores over time, you can see that those numbers well, they were fairly moderate in the middle of a 5-point scale, and then they dropped down to mid 2s, and then it has hovered around there in the last 4 weeks. There's a little bit of variation, but there's also some consistency in where these numbers lie. Using the same type of question, we asked them to also think about travel in the next 6 months. And again, the numbers that are in blue represent domestic travel, and those in orange represent international travel. And you can see the numbers in orange, the mean scores at the top, 2.66 for wave 7 through to 2.29 in wave 10, that the numbers are fairly consistent with the amount of anxiety about international travel in the next 6 months. We have seen that people are getting a little bit more relaxed about domestic travel in the US, although this last wave took a slight dip in the level of anxiety. We also wanted to know the context of what people were thinking regarding their travel perceptions, and we wanted to ask them when they thought the coronavirus would be contained or under control. And you can see in the last 2 weeks, these are fairly consistent, that the majority of respondents believe that it'll be sometime in 2021. When asked about their travel what would be the next likely location that they would take in their trip, either inside the US or outside the US, you can see that in line with what their anxiety levels are, the majority have expressed that they would travel within the US. And we have more slides later on that will talk about what that looks like and when that will happen. We also wanted to ask about the tourism industry specifically, and respondents and gauge what people thought as far as when they thought the industry would be back in business, ready to accept visitors. And in the last 2 weeks, you can see that a larger number think it won't be until sometime in 2021. Related to when they think that the coronavirus will be contained, we also wanted to understand when they thought they would book their travel. And so again, the patterns are the same for the last 2 weeks. There isn't much variation, and the majority of respondents say they'll travel either 2 to 6 months after the coronavirus is contained, or 6 months to a year after it's contained. We also wanted to know whether this was also similar for business travel. And so we asked them to respond how far after it's contained would they expect to plan their business trips. And the patterns are almost the same for leisure travel. The majority expressed they would plan between 2 to 6 months after it's contained, followed by 6 months to a year. And then we also see slightly larger numbers that represent over 1 year. So business travel relative to leisure travel, as expressed by the respondents, there seems to skew further out and may be longer to return than the leisure travel. We also thought it was important to understand differences in expectations between traveling domestically and internationally, and we asked if they had a higher expectation for sanitation if they were traveling internationally than if they were traveling in the US. And last week when we asked it, the numbers were quite substantial. 62.6% said yes. And then this week that has declined a little bit, down to 50.9. But what's interesting is that the no category has not changed. The difference has been made up in the I'm not sure. And so this reflects the idea that many people are starting to think again about traveling, but they haven't thought or spent enough time looking for where that next trip would be. And so they aren't really sure whether there's going to be a different expectation or whether they should have a different expectation in things internationally than what they have here in the US. Next, I'll cover some insights into some changing travel patterns. And here we wanted to also understand perceptions of safety regarding different international destinations. And so we asked people, how safe would you feel traveling to each of the following countries when travel restrictions were lifted to that country? And you can see that the majority of responses are in the mid 2s. Canada and Australia and England somewhat had higher response rates, and so their perceptions of safety were greater, whereas China, understandably, and Italy, understandably, were lower than the averages across the other destinations. Digging into this a little deeper, we wanted to see whether there was a lot of variation by gender. And we know from past research that safety is related to gender, and that most of the time females feel that safety is more important than males do. And that's reflected in this chart here across the destinations. The majority of males have higher scores than females do. We also wanted to look at this by age, and you can see that across the countries presented here that are mostly represented by you in the listening audience follow very similar patterns, and that the most likely to express that it's important to be safe would be from the 25 to 34 age category, and then it drops off significantly by age category. And that obviously older groups have more concern with safety than younger groups do. One of the other things we wanted to understand was what that first trip might look like when travel restrictions are lifted. And so we asked about a variety of different types of trips, and some of this came out of data that was collected in after 9/11 by our department. And we found that there was a significant number of people after 9/11 that stayed closer to home, that also engaged in activities where there weren't the same numbers of groups of people, where they felt that they were going to be safer. And you can see from this chart that the beach and parks are two areas, and then big cities, which is more surprising than not, are areas that are expressed as the first trip that they're looking at taking once restrictions are lifted. Notably also that cruising is at the bottom of the categories with 2.2 both this week and last week as a percentage of response. Tied to this, we also wanted to understand not only where they would book, but things that they may avoid. And so you can see that the kinds of things that people will avoid include cruise travel, stadiums and large sporting events, popular destinations that have densely populated areas, and public transportation. Things like outdoor festivals, airplanes, surprisingly, and hop-on, hop-off buses were expressed less frequently. Although if you look at the percentages of people that responded they would avoid them, they're still close to the 40% mark. We also know from past research that things like staycations have become popular when we have major crises, and especially when there are things related to our financial discretionary income, and that people tend to stay closer to home. And so that was one of the questions we wanted to ask also. And both weeks, just around 3.5 is the mean score related to whether they would take a staycation or not, on a scale of extremely unlikely to extremely likely. The things that come out at the top include making sure that destinations that people are planning to visit have implemented measures that will keep them safe. And then tied to the actual measures is the notion that they've created policies around this. And more than ever, we've seen that people are looking to look at the policy before they decide on their trip. This is a trend and a change that we've seen from past travel behavior. I'm going to get into these a little more in detail now. The next few slides are each one of these where I've pulled out the top 2 boxes, which represent strongly agree and agree. And these are for the last 2 weeks with regards to the question, I'll make sure the destination I'm planning to visit has implemented measures to keep me safe. And you can see that 71 and 72% either agree or strongly agree with this statement. And then that other response that is higher in the response category is that they would probably look at policies that businesses have created, and again, hovering around 70%, slightly under last week and slightly over this week. We can see that people will be looking at these policies. They either agree with that or strongly agree with that statement. We also thought that there could be this shift in purchasing more travel insurance than ever before, and that's tied to policies that different tourism businesses would create surrounding COVID-19. And again, the top 2 boxes are slightly over 50%, actually leaning towards 60% of the people suggest that they will purchase travel insurance. And that's more than what they used to do in the past. So travel insurance, I think, is going to become more commonplace than it has in the past. And then related to this notion of a staycation, which has transformed itself over time as well. I think in the beginning, the idea was that they wouldn't take a vacation at all. And now I think it's being defined more frequently as those that are staying closer to home, maybe taking day trips or staying within the same region. That 50%, around just slightly over 50% this week and last week, both said that they would take a staycation. But that leaves, just under 50% that are saying that they won't, that they'd like to travel. And I think this is related to some of these expressed research findings that are saying that people have pent-up demand for travel. So what will they look for with regards to what the industry is going to provide? We wanted to know that, doing the research over time, that there was going to be an increase in cost to many of the businesses. And that, implementing extensive sanitation practices, providing guests with PPE, doing what's necessary to keep people safe is at a cost. And so we wanted to understand from the consumer standpoint whether they expected to pay more for these increased protocols. And you can see from the data that almost 55% expect to pay more. A third, slightly under a third, say that they don't expect to pay more, and we still have that unsure category. Tied to this is the expectation that they will have to have PPE and that some of these trips will be away from the home. And so we wanted to know, do they expect the companies to provide this PPE, such as face masks and gloves, or would they bring it on their own? And you can see that there's this, large portion of respondents that say that it should be provided by the travel companies. Knowing that people are more tuned in to safety and security and their own personal safety, the more we know that people will have to receive this information, there's going to be a greater demand to share what each of the individual businesses as well as the collective destination are doing to keep people safe. So we asked people, what information would you need to receive through the travel process to feel safe? And then we asked them to check all of them. And you can see the infographic here that says that just about 60 or 76% would like to receive this information in their confirmation prior to travel. And I think that some of that's tied to the idea that they want to know exactly what they would also need to bring in order to keep themselves safe. So whether there are touch points in the experience that where they would have to provide their own PPE, or whether they would also think that they needed to sanitize at different parts of the experience in addition to what was being done in the destination. These are the kinds of things they would want to know ahead of time to prepare. Things also like high traffic areas would have signage telling people, you know, remember social distancing, remember to wear your mask at all times. If there's specific local ordinances that are different, then sharing that information so the visitor knows is going to be important as well. Having that information available in the lobbies upon arrival, such as hotels and airports, is also expressed by just about 52% of the respondents as being important. And then communicating that information by the front line staff upon arrival. One of the things that they also said that they wanted was on a receipt. So if they have different packages that they're purchasing beyond their accommodations or their transportation, that each of these also are providing information about what they're doing to keep the traveler safe. And then just these verbal confirmations by frontline staff throughout the travel experience. So what do they expect? You can tell that there's a variety of things that are being discussed in the literature, in the news, by associations about what it's going to take to keep people safe. And so we wanted to know from US travelers what they would expect with regards to their safety in locations such as attractions, accommodations, and airports and other places. And you can see from this infographic that 91.4% expect touchless hand sanitizers at the entrance and exit to their various touch points through the experience. And these numbers are all quite high. And the expectation, again, going back to that slide, that the industry will provide these is also very high. So whether it's sanitation practices, disinfectant wipes that are being provided, options for online ordering, for example, food. Also tied to that, I'll have a slide later that includes cashless transactions. Advice from visitors with flu-like symptoms to stay home, and providing employees with PPE in addition to the visitor, and then enforcing the notion of social distancing and looking at capacities. One of the things that I worked with Tom and Larry about is understanding things like shared equipment and how likely it would be that US travelers would book trips that require these shared equipment, things like snorkel gear, helmets, gloves, etc. And you can see here that I pulled out the top 2 boxes, but those numbers are fairly low. The more important part of this slide is that the extremely unlikely and the unlikely, somewhat unlikely, represent the majority. So that dark blue pie piece and then the orange pie piece representing 67%. So there's concerns there about cleanliness, and we asked them also to explain, and it's about the transmission of the virus because of shared equipment. Tied to this, we also wanted to understand how likely it would be to book a trip that requires use of shared facilities. There's been some comments about pools and clubhouses and tennis clubs, etc. And again, the numbers are a little high and they're skewed negatively, where 48%, slightly under half, are represented by extremely unlikely or somewhat unlikely. A larger percentage here don't really know, and so they're still in this seeking information stage. We also wanted to understand perceptions about paper tickets and using paper as a transaction piece. And so we asked them, is a paper ticket acceptable? And 21% said yes. 36% said no, it should be replaced by a touchless ticketing process. And tied with that response, 36% said there should be both. But asked when respondents were going to travel again, whether they would carry cash, 41% that they would be likely to carry cash. Those that we asked regarding using touchless transactions, we also wanted to understand, you know, the breakout of the type, and you can see it's all over the board. There's no dominant use, and that becomes both an opportunity as well as a little bit of a challenge. Continuing with our research over time, we wanted to understand the expectation of the economy and how that will affect personal travel plans. And you can see that 63% say that it's going to impact their travel plans. And so we wanted to know how, and we asked them whether they would seek less expensive alternatives, and 37% said that they would do that. Just under half, 46.2%, said that they would stay closer to home. And then a small percentage, just under 20%, said that they would spend it on renovations rather than traveling at all. Again, trying to understand business travel, we wanted to understand how the economic conditions would impact travel and business travel. And so we asked, do you expect that the economic impact of the pandemic will affect your employer's travel policies? And just under 50% said yes. And then linked to that also is the notion of a travel budget, and very similar and following the same patterns, 47% said that that would also be the case, that the travel budget would be impacted. And we're nearing the end. One of the things that we're also hearing is the idea of sustainability of destinations, as well as willingness to invite visitors back to your community. And so we wanted to get a better idea of how willing the US residents were to open their community to tourists right now, today. And you can see that 17% is represented by extremely willing or willing to do so, but that the majority are unwilling or slightly unwilling, and that represents 54%. So what do we know from all of this? I think it's also consistent with what we're hearing, that there's a variety of expectations of people's safety that are major underlying factors in decisions to travel. and that when people feel safe, that they will be more likely to book travel and to use their discretionary income to engage in leisure travel. Those destinations and businesses that come together collectively to invest in communicating and investing in what that sanitation and safety practices and procedures are going to look like, and communicating that back to the consumer, are going to do better. Science has become more of a way of life now that we're staying at home and we have access to the television, and more information that is being communicated on the coronavirus is being communicated with science-based information, and decisions are being driven by science. That is also filtering over to other aspects of people's lives. So the more that you can use science to defend what you're doing and what you're engaging in, and increasing your level of credibility, the more likely people will be to book with you. More information will be available, as I mentioned, on Monday, and we'll continue to be committed to tapping the perceptions of the U.S. traveler market. And we're excited to be able to see when people's anxiety returns to normal levels. We've also created a travel anxiety index that is available on the website. So if you go to www.uftourism.org/COVID-19 TCMI, you can find some of the reports there. An easier website is www.tourismcrisis.org. Both of those will take you to the Tourism Crisis Management Initiative website, where there's a variety of reports available that we've been producing since January. And that's all I have right now. And I will turn it back over. Larry.
Hey, Lori, thanks so much. That was fabulous. Many thanks for the valuable research and insight. It was excellent. Let's give Lori a quick break. And I want to pull up the poll for a minute, and Tom will be coming back in a second to ask a few questions for everybody. So let's pop up the poll, and please feel free to provide us some feedback. Well, super. While we let others go ahead and fill in the poll questions, Tom, you want to pick up on a few questions we got from the attendees?
Yeah, let me go ahead and jump into that. You know, some of those stats that we saw in the survey certainly have raised my own anxiety.
Sorry.
Hey, we did get a few questions here. One, I think that's really pertinent. It was from Anki, and 54.5% of the visitors expected to pay more for, I think, let's say the efforts of PPE, sanitation, et cetera, that cruise lines or tour operators do. So I guess it's not so much a question as it is a point to everyone listening that, you know, this may be something you want to really take note of and discuss with the cruise lines, because certainly there are additional costs that go along with that are valid, and you can't hand out a face mask or gloves or, you know, sanitize a bus or something without a cost. And I'm assuming, Lori, that you'd agree with that.
Agreed. I think what's consistent with the research we've been collecting for a decade but has really become even more pronounced now with COVID-19 is that people are not going to make decisions if their safety is in jeopardy or if there's any risk to their safety. And so this is a reflection of the fact that, you know, if you discount prices, that's not going to drive people back to your business. People will, you know, use in the decision-making process the evaluation of their safety as a first layer, and then they'll look at subsequent things. But the willingness to pay more basically reflects that they're going to look out for their family safety, their personal safety, and the safety even of the people that they're interacting with in the communities before they look for discounts, etc. Those are the things that are not as important.
And it seems to me that a lot of this is also rooted in the effectiveness of the communication. And where can people that are listening go to get a little bit more guidance? You touched on it in your presentation that, you know, the proper signage is important, but it almost seems like what's super important is getting this information out to the decision well in advance of the cruise or well in advance of when I actually take my tour. You know, how should tour operators try to communicate all the things they're doing to make sure that they're bridging the gap of, say, sanitation, social distancing, this type of thing, communicating their efforts so the guests can make an informed decision?
Right. So I think there's two pieces to this. One is that on a business level that they need to be communicating what their policies are and the level of engagement in sanitation and policies that they have adopted for their business on their website, you know, in their print materials, you know, in social media, that they need to, that's now going to be part of the norm, right? That people are, if I go and I look and I want to make a decision on which, you know, hotel and which activities that I'm going to participate in, I want to see that I can evaluate, you know, my safety. And so if they don't have some mechanism to explain what they're doing, I would say it goes beyond a corporate stance as well. The corporate businesses can have something, but on an individual business level, I want to know on the front line, what are you doing? I want to know how it's going to actually translate into my experience. And so, you know, some of the information I said that on the back of receipts, you know, now as part of the information when they're booking business, that it appears on their confirmation. And there's a new little piece that says, you know, here's our policy. This is what we are doing. For more information, you know, please ask here. You know, so it becomes a two-way conversation, that it's not just, it goes back to the notion of trust, right? Trust is got to be communicated. Trust has to be earned, and you can't just expect that people, if you say you're doing something, that they believe you're going to do it. So there has to be also proof that you're doing these things, whether there's supplemental videos of your staff doing it, whether it's you're asking your guests to take pictures and upload them to your social media sites as confirmation that you're doing it, whether it's you're engaged in, you know, some public relations, you know, campaigns, but there's going to have to be enough information that as a consumer, I say, yep, I believe that they're doing what they need to do. And I don't just believe it, I see that they are. These are the kinds of things that they're doing. So
a lot of thought has to go into the communication of it. Another question that came through, with all these new protocols, reduced capacity, sanitizing investments, et cetera, many tour operators are saying, how much is too much? Can one draw the line to say when it is enough? My hunch is, or is that really the consumer who says it is enough?
Yeah, because the consumer is going to book, they're going to vote with their pocketbook. And if you don't convince them that they're going to stay safe, then they're not going to book. So there is no enough if you're feeling that, there's apprehensiveness or anxiety, then it's because you haven't communicated to the extent that the visitor feels that you're meeting that, Maslow's hierarchy of need, that low level need, my safety.
Cristobal says, hi, doctor, could you please repeat the top 3 takeaways?
Oh my goodness. Okay. I would say one is that that it's not going to be a standard, open and close process to reopening, that it's going to be a phased approach, that consumers expect that you're going to engage in these practices, and the details in that infographic represent that there's a large number of things they're expecting from the tourism businesses, and that they want to see that you're communicating that to them at various places through their experience, and that that the people's anxiety is going to be related to their perceptions of safety. And
Okay.
so if you can help to manage their perception of safety through some of these, engaging in some of these practices, putting together policies, having statements, then that's going to be able to help to mitigate that level of anxiety to a certain extent.
Hey, Tom and Lori, it is 3:01. I'd like to still continue with a few questions if you've got some, Tom, as long as Lori, you're okay to stick out. We still got quite a few people on the Zoom call. So if you're willing, Lori, we'd love to ask a few more.
Sure.
Okay, I'm going to talk fast then. Matthew wrote in, and I think he may have might be confusing the statistic here just a little bit. He says 2% of individuals said that they will cruise again. How does that compare to what the normal demand was cruising during normal times? And was that 2%, or that was the people that rated it as a 2? Maybe you can clarify that point.
Let me pull it up. I want to make sure I have the right one. I don't want to share the screen because it takes forever to do that. So just give me a minute. So here this is, yeah, the percentage of people that said that they would use the cruising as their first travel experience when restrictions are lifted.
So that's only 2%.
2.2%.
And so the question is, under normal conditions, well, do you know about what that percentage would have been sort of pre-COVID?
No.
Okay.
I don't have that.
You said that majority are willing to open, are unwilling in the United States to open their community. Is it fair to infer that this would translate in a similar way to destinations internationally, like maybe certain Caribbean islands?
So what I'm hearing in a global context is very similar, that people are having more, like, using their voice to express how they want their community to look, and what level of tourism that they will have. And so, yes, this is a US context, but I would say, if I had to hypothesize, that there are similar findings around the world, that this is that pause and reset. And for conversations like over tourism that we've heard so much about in the last year, this is this is related to that people, destinations that now have an opportunity to go back and say, maybe we have a say in what the next phase is going to look like for the destination.
Mm-hmm. Do you think there's any legal implications to communicate a COVID operating procedures for a tour operator, or is that outside of your wheelhouse?
It's somewhat out. I would definitely say that using a lawyer is important, but I think what is important also is understanding how to communicate the on a country level and not on a regional or on a city level, what the laws are in that area. So if there is a specific ordinance that says that everybody has to wear a mask in a public place, both as an employee and a consumer, then that should be communicated, that, and you can reflect back to what that law is. When it goes above and beyond, those are the kinds of things where I think there's a great opportunity to continue to have these conversations at the destination level with multiple stakeholders, because you're not going to be the only one that is, you know, looking at the same type of messaging. It can be collective, and there's going to be something that is created. So working with your destination management organization, working with governments, all of these are a good opportunity to kind of start that dialogue and put those messages together clearly.
Okay, thank you.
Fantastic. Lori, we want to thank you very much for taking the time out of your busy schedule and sharing your research and providing the valuable information during this challenging time of the crisis. We also appreciate the availability to share your presentation on our website, and those that wish to study it, you know, further, it will be on the website, hopefully by the end of the week, along with the video. Thanks again, and we will continue our conversations with you for any further insights. I think that's basically once a week we've been talking to you, isn't it?
That's right.
So, for all of our listeners today, we hope you will join us again next Wednesday, May 13th at 2 o'clock. It's tour operations and the new normal. Learn firsthand how tour operators on the eastern seaboard of North America are reimagining their business to prepare for their first tourist of the summer season. Please visit our website, www.destinationstogether.com, and register for next week's webinar on Wednesday, featuring John Welby, Historical Tours of America, and Dennis Campbell of Ambassador Tours. We want to thank everybody for joining us today, and those that provided questions. Be strong. Lori, again, thanks for participating today. It was fantastic. Tom?
Thanks, Tom.
To all the listeners out there on Zoom, thanks for your support and participation. Until next time, stay healthy and take care of each other. Thanks.